In her first television interview since taking over the State Department of Health less than 2 weeks ago, Dr. Libby Char talked with one-on-one with our Gina Mangieri, who, of course, is always investigating.
Dr. Char took on some hard questions without flinching. She also spoke frankly about how she's navigating some of Hawaii's most crucial functions through this pivotal time in the pandemic. Dr. Libby Char brings her experience as a physician and a public sector emergency services manager to the State Department of Health, replacing Dr. Bruce Anderson, who retired last month.
What are you doing that you're seeing now on the inside? What are you seeing and what are you doing to right that ship and to restore public trust?
There is an awful lot of really good work, very professional people, technical experts, and people are working so hard. And I think a lot of that has just been overshadowed. Yes, we want to restore public trust. I think, we've done a lot to that end. We've improved contact tracing, the whole process. We've hired more contact tracers and epi specialists. And I think we're trying to work on making things more efficient and streamlined.
Hawaii is unique in that we don't have county health departments, just one single state department. Dr. Char wants to change the mindset.
We still need to partner with the counties, with private sector, with businesses. I think we need to build those partnerships, and that's what's going to allow us to move forward. We really, really need that collaboration.
More focus on Kupuna is on the way in the wake of an ongoing deadly cluster at a Big Island nursing home.
Yukio Okutu is just heartbreaking.
She's directing more support for testing for care and nursing homes and enlisting the help of the State Emergency Management Agency and added infectious disease staff.
So those infectious disease specialists go to the long-term care facilities and they're out in the community, and they help to educate the staff and they can help make suggestions and provide guidance and whatnot.
What is the State Department of Health doing to increase and support a much higher volume of ongoing tests, and at the same time to make sure that they're actually valid and reliable platforms and methods?
Testing is actually a really important topic to me. We met all weekend, all day Saturday and almost all of Sunday to work on this. We're trying to develop a more comprehensive testing strategy. We want to increase the testing capacity, but we need to do it smartly. And we need to focus on the priority areas as well as on surveillance.
The feds recently asked states to have a fully operational vaccine distribution plan. Dr. Char says she's working with point person Lieutenant Governor Josh Green, federal agencies, state emergency management, and others.
We are meeting several days a week with this because the federal government is expecting a plan in October. So we are trying our best to meet that deadline. We really need to get the public's buy-in on it as well.
Short of a vaccine for now, we asked what's working to shorten hospital stays or hasten recovery.
Very promising to see the dexamethasone and also the remdesivir. And we've been getting weekly allotments from the federal government.
She addressed the resources her department still needs, shared guidance to keep schools safe, how to get more data on a new dashboard, and travel testing. That's in our extended interview online at KHON2.com. Gina Mangieri, KHON2 News, always investigating.